Any objections, please disconnect at this time. Thank you very much. And on behalf of the Sustaining Coalitions Work Group, the Comprehensive Cancer Control National Partnership, let me be the first to welcome you to the final of our three-part series on the 9 Habits for Successful Cancer Control Coalitions. We're excited to round out this great series of chats, but before we get started, a brief word or two about logistics, and then I'll pass everything off to my colleagues. We ask that if you're not already on mute, to please keep your phone on mute for the duration of today's presentation. As mentioned, the session is being recorded, and muting all the lines will help us avoid any background noise. We encourage questions and really do hope that we'll hear from a number of you today. Questions and comments can be submitted by using the chat box feature on the right-hand side of your screen. You type your question and/or your response in the provided box and then hit submit, and you'll be added to the conversation. Feel free to submit your questions at any time during today's call, but we will save all the questions for the end and look forward to so that we can get all of our speakers in and also, really have a very robust conversation. While we're getting started, I want to give everybody an opportunity to give the chat function a whirl. So we have 2 questions for you to start us, and we'd like to know who's on the call and who your interests are. And while we are and while you're working on that, let me turn the controls over to my colleague and co-chair, Sarah Schaefer.
Thank you, Margaret. Good afternoon, everybody. This is Sarah Schaefer with the American Cancer Society, and I'm pleased to join today's webinar and excited that you all could join us. And as Margaret said, today's webinar is being brought to you by the Comprehensive Cancer Control National Partnership Sustaining Coalitions Work Group. You have joined the third of the 3-part webinar series on the 9 Habits of Successful Comprehensive Cancer Control Coalitions. Today's webinar topic is diversified resources. I think we have a little bit of feedback, so if you don't mind muting your lines, that would be really helpful.
Are you getting a cookie? Okay.
So as I noted, our webinar series has been based on the 9 Habits Guide. If you're not familiar with the 9 Habits Guide, you may find it at the Comprehensive Cancer Control National Partnership website. We've had a series of webinars to date providing some refreshers on the habits. Earlier this summer, we focused on empowering leadership and priority work plans. I hope that you were able to join us for those webinars. If not, you can also find the links to the recording of those webinars at our website. So the webinar series was designed after getting feedback from Comprehensive Cancer Control Coalitions. And these 3 topics were selected because those are the ones that were most highly asked for in our survey. So we're really pleased that we were able to deliver on that. We will continue to have conversations with you about the 9 habits and further work that we can do to help support your efforts in implementing the 9 habits. So the Comprehensive Cancer Control National Partnership, I hope you're all familiar. Again, if we could mute phones, please. The National Partnership is led by 19 member organizations. You can see all of the logos of those organizations here on your screen. The national partners have been meeting together for 15 to 20 years. We've been going strong, and we've primarily focused on how we can provide technical assistance and training to the National Comprehensive Cancer Control grantees. We are led by a chair and a vice chair. Currently, Cindy Vinson from the National Cancer Institute is serving as our chair, and Frank Bright from the National Association of Chronic Disease Directors is our vice chair. We do have a work group structure, and so as mentioned, Margaret and I are co-chairs of the Sustaining Coalitions work group. So our work group has really embodied the 9 habits And this was a resource guide produced by the national partners a few years ago now. And after lots of research and input from coalitions across the country, we settled on these 9 habits or attributes of what goes into a successful coalition. So there's 9 areas: empowering leadership, shared decision-making, value-added collaboration, having dedicated staff, diversified funding, effective communication, having clear roles and accountability, flexible structures, and priority work plans are really the secret sauce that goes into maintaining coalition work. So we are actually, because this is a few years out, we are actually looking at an update to the 9 habits, and we'll be asking all of you for feedback in improvements that we can make across the habits. Again, I'm going to do a shout out for muting telephone lines. I'm getting a ton of feedback on my end.
I know. I was thinking that. Like, where can I get?
So I apologize for the conversation happening in the background here.
Yeah,
so we will continue to power through despite this. So we have a wonderful panel of speakers here today, and I thank you all from the bottom of my heart for joining us in putting on today's webinar. I'm going to start with introducing Karen Homan and Leslie Given, who are with Strategic Health Concepts. And they have been supporting the efforts of comprehensive cancer control across the country for many, many years, and really provide awesome leadership, guidance, and strategy development, both at the national level and at the grantee level. So many of you have called on them for their expertise in helping to work through issues. And we are lucky at the Comprehensive Cancer Control National Partnership level to have their expert guidance and leadership. So they will be joining us today and actually are responsible for putting together today's webinar, so thank you to you both. We are really happy, too, to be joined by experts in the field, your colleagues, to talk about their experiences in leveraging a diverse set of resources to help their coalitions and their comprehensive cancer control programs move forward. So we are fortunate to have Julie Sargent, who is the Comprehensive Cancer Control Program Director from Kansas, who's joining us. And she also works with the National Breast and Cervical Early Detection Program and a new palliative care initiative. Julie has been in her position for 7 years now. Also joining us is Hope Kriebel, who is the Executive Director of the Midwest Cancer Alliance, an outreach network of the University of Kansas Cancer Center. In addition, Hope supports Pivot, which is a patient and investigator voices organized together, a patient research advocacy initiative, and Kansas Patients and Providers Engaged in Prevention Research, which is a primary care practice-based network. Hope is on the Kansas Cancer Partnership Steering Committee and is the chair of the Missouri Cancer Consortium. She has been doing this work for 25 years and has really led her expertise to us time and time and again. So we're very fortunate to have you today, Hope, with us. And we are also joined by Christy Cahill, who is the Cancer Outreach Specialist for the Comprehensive Cancer Unit at the Colorado Department of Public Health and Environment. Her role focuses on providing capacity building and communications for the Colorado Cancer Coalition. Christy's career has been devoted to program planning and communications for cancer-related organizations. And finally, last but not least, is Henry Well. And Henry is the Executive Director for the South Carolina Cancer Alliance, in which he's been in that role since December 2015. His connection in the Alliance began in 1999 when he served as the co-chair of the Patient Care Task Force for 3 years. Mr. Well is a seasoned leader in the nonprofit industry with over 18 years of experience in the nonprofit health sector. He previously served in state and national leadership roles with the National Kidney Foundation and the American Cancer Society. Thank you for joining us today, Henry. And that concludes our list of speakers, and I am going to toss this ball down to Karen. Karen, once I find your name. Margaret, I'm having trouble moving the ball farther down my list here. Can somebody move it for me? Ah, Karen, there you go.
I just did. Karen, go ahead, please. Thank you.
Thanks, Margaret. Hi, everybody. So good to have you all on the call today. Really what Leslie and I want to do is just do a very quick overview to make sure we're all on the same page as far as what do we mean by resources. When we use that word, what do we think about as far as where resources come from and why we need them. And then really the rest of this webinar will be from experts in the field about how they've been very creative and innovative in finding resources to implement priorities within the comprehensive cancer control plans in their states. So all this is probably pretty recognizable to you. When we talk about the types of resources, we're really talking about two different buckets, and one is actual money. And so, as we all know, CDC has cooperative agreements for the program, for the Comp Cancer program, and those funds are to support the coalition in a way that they can develop the actual state plan, but not necessarily implement the plan. So our challenge comes as coalitions and as programs as to how can we take priorities from the cancer plan and go about implementing them. But that there is some money there that we get from CDC cooperative agreement. Some of the states, and you'll hear about this today, are very good at identifying and obtaining state funds or tribe or territory. The government actually will say, we believe in this enough that we have to provide some additional funding to the Comp Cancer program or coalitions to implement the cancer plan. And that's obviously a much harder and challenging thing to do, but as we all know, that is an area that we really need to look at. How do we get that stakeholder support, especially from our elected officials? Another source of money type of resource is from grants and foundations. And that is something that we'll talk about a little bit later, but that is an area that, again, is challenging because there are many competing priorities in our states, but there's a definite strategy for getting those monies. And then another area, and you'll hear about this a little bit more today, is some coalitions have member fees or ask for contributions or donors from the actual coalition partners. And that's another source of actual money. And then, as you're all probably very well aware of, that often we ask our partners in coalitions to provide their expertise and staff time. I think more and more we're learning how to be creative in this area and identifying students or master's degree interns that can be specifically assigned to a specific program for a short period of time. And then we see all the time people donating meeting space and food, web hosting, and communication materials. So one of the things that we used to talk about, I think several years ago, is, let's figure out how to resource our entire cancer plan. And I think through the evolution of Comp Cancer and the evolution of coalitions, we've become a little bit more savvy in how we talk about how we obtain resources and what resources we need. And so we're seeing more and more, and I think it's the right thing to do, is that as cancer coalitions are identifying priorities from the cancer plan, they're looking at how to resource those priorities, not necessarily how to resource the entire cancer plan. So as the Cancer Coalition identifies a handful of priorities, and again, I believe everybody's probably very familiar and it does this in their own coalitions, then around those priorities, a resource plan is developed. And that comes out two ways. One is through actually developing an implementation action plan how are we going to get this done, who needs to do what, and by when, as well as identifying the resources needed to successfully implement that plan. And that resource plan is very specific. It's very much geared to who might want to be funding this implementation priority, who's going to go after that person or that foundation or that organization. So it's not just enough to say, here are the resources we need, but to actually then take those resources needs and to develop a plan around that. And the other thing is to always be talking about this. How can we do a better job? How can we get resources? Who out there might we know that can provide those resources for us? And that's a conversation that should be happening all the time with your coalition leadership group and your coalition. So how do we secure resources? Again, you're going to hear some three really great ways that people have done this. And but the biggest thing is to ask. I always go back to an example when my kids were growing up, is that in their elementary school, every monthly newsletter was a list of resources needed, and it ranged from Kleenex to refrigerators. And I was always amazed that everyone always came to provide that. They didn't know what was needed until the school asked for it, and people are always willing to step up. So the biggest thing, I think, is letting people know that what resources are needed and for what, and disseminating that widely, not even just among your coalition, but maybe other potential stakeholders. Collaborating on securing grants. Often coalitions are not 501c3s, so they can't obtain those fiscal resources themselves because they're not a fiscal agent. So finding a fiscal agent that is willing to be on a grant as the fiscal agent, an organization that's willing to accept different resources, but not even just monetarily resources. And again, you're going to hear about this today, that there are ways to have dedicated staff within a partner organization. And as I mentioned before, identifying students and interns that can get some of the work done. Links specific ask to plan priorities. People are much more willing to give if they know exactly what their money is going towards. So instead of we're going to implement the cancer plan, something like we are going to implement colorectal cancer screening in this area of our state is a great way to get people on board and get them more invested in the resource needs that you want. And then another thing that we've seen, which I think is really great, is when partners in your coalition have their own grant funding mechanisms. Lots of times, obviously, they can write in requirements for that grant funding. And so to ask them to link that funding to specific priorities within the cancer plan is a great way to help the kind of on-the-boots movement and coalitions or local communities get behind the priorities in your cancer plan, and because they're required to as a part of a grant funding. So this is an opportunity for you guys to weigh in. We're curious, and you can do this in the chat. Make sure you respond to everyone. I think you have two options. One is to respond to Margaret, and one is to respond to everyone. So do you have action plans that identify resources needed to implement your cancer plan priorities? So simple yes or no is fine. And then you can put number one, yes or no, and then number two, how do you feel about diversified funds to support your coalition's priority efforts? Do you feel like you're just totally reliant on CDC's cooperative agreement funds, or do you have other funds that are helping your coalition implement priorities? So please get in there and chat. So some people are saying absolutely yes. Some people don't know. Thank you, Bridget. Thank you, Karen. Thank you, Hope. Others? Okay, this is really not surprising, kind of a little bit of a mixed bag. Um, and obviously the rationale behind this is one, action plans that identify resources needed to implement your cancer plan priorities. If you don't know what you need, you can't ask for it, right? And then, and diversified funds are so important. And again, it's not just those funds that are monetary funds, but in-kind funds. We want everybody in the coalition to feel like they've got some skin in the game. And that comes from lots of different ways, from being an active member on a work group. It means maybe dedicating some space or a staff member. It means maybe membership fees. So we want to make sure that we're not just completely dependent on cooperative agreement funds. And as we know, they are very limited. So it's not going to help with totally with implementing the cancer plan. So with that, I think we will move on. And Margaret, I'm having this same issue as Sarah did. If you could pass the ball to Julie, that would be awesome.
Thank you, Julie, it's all yours.
Thank you, Margaret.
Okay, thank you. So I just realized I need to move over there by the computer to change the slides. Okay. So I am going to be talking about strategies to obtain resources with a focus on staffing solutions. And so I'll be speaking from my perspective as the director of the Kansas Cancer Programs, which includes Comp Cancer. And I'll be turning it over after I say a few things to Hope Crable, who's the executive director of the Midwest Cancer Alliance, who's going to share her perspective of how we leverage resources for staffing through this partnership. So the objective of the talk we're doing today is to share a strategy for hiring coalition support through a partner. And we hope you'll get an understanding of the benefits to the state health agency or whoever your lead agency for your grant is, and also the benefits to the partner who you're working with. So to give you just a perspective of the context that we work with, so our story here will make sense, is Kansas is a large rural state. Our population is less than 3 million. 40% of the population lives in rural areas, and we actually have 36 frontier counties and 32 rural counties. And it takes a minimum of 6 to 8 hours to drive one way across Kansas on the interstate. And that has an impact on a lot of what we do. Sorry, I'm having to turn around away from the phone in order to change the slides. So our structure for our partnership, our partnership is called Kansas Cancer Partnership. It's an energetic coalition with dedicated partners, and we have regional cancer coalitions. That's how we handle the support in the rural areas. And we do activities at the state, local, and regional levels. And in order to support all of this, we've had to leverage funding, both financial and also staffing issues. So the structure is we have a steering committee and formalized relationships with the Tobacco-Free Kansas Coalition and the Immunized Kansas Coalition through shared board and steering committee members. We have 3 work groups that focus on our priority areas, and we also have a standing policy committee. In addition to the above, we support our regional cancer coalitions. We started the regional coalitions based on a self-assessment in 2012, which identified that distance to meetings and participation in rural areas was a challenge. And so the leadership of our state coalition suggested regional coalitions as possible solutions. So we formed an ad hoc committee and we brought in external evaluators to help us decide how to best structure and develop the regional coalitions. So we launched into a regional coalition planning process with the external facilitators, and this gave us a blueprint for how we were going to move forward to develop our regional coalitions. And so we used this blueprint and we incorporated it into our grant request to the CDC, and we requested and received funding for a position through the Comp Cancer grant to support the regional coalition. So we were on a roll. I mean, we got funding for the positions, we were going to do this, and then we ran into a barrier. We got into a hiring freeze, and most of you have been there, and it can be very frustrating just when you think you're gaining momentum and you get a hiring freeze. However, we did not let this stop us. So we didn't want to lose our momentum, so we contracted with a partner to provide regional coalition support. We contracted with the Midwest Cancer Alliance. The Midwest Cancer Alliance is also known as MCA. It's a membership-based organization that brings together cancer research, care, and support professionals to decrease the burden of cancer in the heartland. The MCA is the outreach division of the University of Kansas Cancer Center, and it's comprised of a network of hospitals and healthcare organizations throughout Kansas and western Missouri. We have a lot of goals in common, so it was a good fit. We contracted with MCA and worked together on a position description and a training and orientation plan. So out of this partnership, we got Ashley. Ashley Adarante has done an incredible job developing and supporting regional cancer coalitions, and that was the original intent of the position, but we've gotten so much more out of it. To make the position work, especially in the beginning, we set up in-person meetings, and then we went to weekly phone calls to ensure we were on the same page to implement the activities. And that was 5 years ago. The relationship has worked out well for the benefit of our Comp Cancer program, the Midwest Cancer Alliance, and the State Cancer Coalition. In fact, once our hiring freeze ended, we opted to keep this relationship and continue contracting the position with Midwest Cancer Alliance. And we're glad we did, because now during the 1701 project period, this has helped us maintain the 40% limitation on staffing and still provide support to the coalition that we want to do. Things are going very smoothly these days. We now hold phone calls monthly instead of weekly. We don't have to have communication as often as we used to. One thing we do is help support Midwest Cancer Alliance staff to attend some of the Comp Cancer meetings and conferences. And now I'm going to turn this over to Hope Crapel, who will be able to tell you some of what they've been able to accomplish through this relationship for the coalition and their perspective. And this will take just a second, I think, to...
Thank you, Julie. I really appreciate the opportunity to present to you all. The Midwest Cancer Alliance has supported the Kansas Cancer Partnership Regional Coalitions in 3 areas, and will be emerging and moving into a 4th area. So Ashley Adarante supports the North Central Coalition, which is based in Salina. It's a mid-sized city that connects to rural counties in their region. The Southeast Coalition is based in Pittsburgh, which is located in a region that has elevated poverty, higher colorectal cancer incidence and mortality rates, and higher smoking rates compared to other areas of the state. And the South Central area, which is based in Wichita, the largest city of Kansas. We have an emerging coalition in southwest Kansas for the Kansas Cancer Partnership. This area of our state, although rural, has multiple counties that are minority majority. And even though it is located 6 hours from Kansas City, MCA already has staff that travel to Garden City regularly for other projects that include collaboration with an FQHC. We have a strong relationship with a local hospital and as well as the cancer community in the Southwest region. We felt that we could support this 4th regional coalition because of these existing relationships and our frequent travel to the region. This collaboration is really a win-win for MCA and KCP as it helps us support goals and leverage resources for both of our programs. So each regional coalition goes through a strategic planning effort to identify cancer prevention and control priorities for their regions. The MCA staff work with Comp Cancer Program and the state coalition members to leverage resources and provide any technical assistance that might be needed for local and regional projects. By leveraging these resources through the Comp Cancer Grant and our own internal structures, MCA has been able to support activities such as colorectal cancer screening campaigns, cancer survivorship resources, and HPV documentary viewings. And I would like to pause here and say one of the ways that we can support and use real resources is help with the food budget. We recruit interns each summer to implement Pool Cool across the state, and we've been successful in leveraging additional resources for professional education related to state coalition priorities, for example, training primary care providers on survivorship and supporting patient navigation professional education programs. The MCA also supports Kansas Cancer Partnership's Facebook page. We are able to post announcements about coalition-sponsored events, opportunities for involvement, and health education messages almost in real time, which is important for social media. As mentioned, sorry, I'm trying to get this to move on. As mentioned earlier, MCA has benefited from the relationship with the Kansas Cancer Control Program and the Kansas Cancer Partnership. This collaboration has helped us to support relationships with the community and healthcare providers across the state. It has helped to connect our MCA member voices to the Kansas Cancer Partnership. It has expanded our priorities projects such as cancer survivorship efforts, as well as support the pipeline of new public health professionals. It really has also helped us learn more about what is available through the Comprehensive Cancer Control Program. So if we have data needs, we're able to really know and reach out to our partners in the health department. So it's been a real pleasure to partner with Julie and her team. I think it's been a real benefit to both the MCA as well as the Kansas Cancer Partnership. So I'm going to try to pass the, looks like Margaret has done it for me. Thank you, Margaret.
Great. Thanks so much, Hope and Julie. Really appreciate that great collaboration and sharing of resources that you guys have done. So, Christy, I believe you have the controls, and Christy's from Colorado and is going to talk to us about what Colorado has done.
Perfect. Yes, thank you all. So again, I'm Christy Cahill. I'm at the Colorado Department of Public Health and Environment, and I'm excited to share how we've worked with our Colorado Cancer Coalition. So I'm going to talk about voluntary contributions on tax forms as a way of raising money. So I will just get right into it. So in 2010, there was a very vocal breast cancer survivor and some people that worked with her that saw the voluntary contribution form and tried to figure out how the coalition could get put on it. And so they found some legislators to support it and got the Colorado Breast and Reproductive Cancer Fund onto the voluntary contribution form. And so this is when people submit their taxes, there's 20 organizations listed that can contribute, that you can contribute to when you file your taxes. So you can write in an amount, you can give your entire refund. Even if you weren't getting a refund, you could put in a new donation. So it's been around for 40 years, actually. The voluntary giving has been around. Then in 2012, the coalition decided that it didn't want it to just be breast and reproductive cancers, so we changed it to the Colorado Cancer Fund so that it could be for all cancers and all cancer plan priorities. So the voluntary contributions is one of the ways that our coalition is funded. Some other ways that we are funded are through general sponsorships of our symposium, just general donations, and then we call that the voluntary contributions is that Colorado Cancer Fund. Another big thing that our coalition benefits from is in-kind staff time and volunteer time. I know you guys know all about that. The way that we handle our current finances is through a fiscal sponsor relationship. So we don't technically have our own 501c3. We piggyback on our fiscal sponsors 501c3, but they handle all of our accounting, taxes, fill out the 990. They handle all of that so that we don't have to worry about it. They do take, depending on the source of the funds, they do take an 8 to 10% cut as soon as the check comes in the door, but it's definitely well worth it to have all of that accounting taken care of. So last year, we made $72,000. So from 2017 taxes, we made $72,000. And the year before that, we had made about $68,000. I'd say over the lifetime of it, we've made anywhere from about $90,000 to $45,000. They did write a new statute that you have to make at least $50,000 to stay on the form. So how we ensure that we stay on the form, I'm going to skip ahead and then come back. How we get the word out there about giving on your tax form is we've got a volunteer committee, and they help guide the marketing plan. So we've used radio ads, we use social media, we put together a toolkit that people can download that has pre-made messages about why the fund's important, where the money goes, what the coalition does. That way it's very easy for volunteers to just copy and paste and put it onto their own social media networks. We've done some paid advertising in the Denver Post, as well as just trying to get other spots in articles. So that's one of the ways we make sure we reach that 50,000 threshold. I'm going to go back now. So once all that money comes in, how do we decide what to do with it? So when we got put onto the tax form, in the legislation it says that basically all we have to do is create an advisory board to then grant out the money. It's very, very generic, which is great. So the steering committee for the coalition reviewed all of our data from the cancer plan to see where we were lagging behind. And so this past year, we prioritized skin cancer, HPV vaccines, and healthy behaviors among cancer survivors. And then we also prioritized geographic areas, like more rural and frontier. And then if you were already involved with the coalition or you were part of a task force, we also heavily weighted that to try to encourage task forces to apply for this funding opportunity. So in 2018, we funded a Reveal Imager for skin cancer education in Grand Junction. So we have a pretty good presence in Metro Denver. Med school students or dermatology students take the camera around to lots of different outreach events and provide skin cancer education and show people how much sun damage they've had. So we just provided another camera in Grand Junction because it's 3.5 hours away, so it's a little bit too far to travel all the time you want to use it. So now they have their own out there. And they're doing some really cool pre and post-test behavior change surveys, so more to come on that as they use it more. We also provided some funding for motivational interview training for patient navigators to improve cancer screening rates and also to improve HPV vaccine adherence. We've funded some retreats and educational sessions for cancer survivors, more HPV education in different populations, and then our colorectal cancer task force is looking at a length of care approach, so trying to model after that surgery on Sundays and other things like that. And that's just a small sampling of what we have funded on the coalition's website. You can see all the different grants that went out. That is it in a nutshell. It's been great. It's been a great source of $50,000+ year after year for us to grant out to people involved in the coalition or people we want to get involved in the coalition. So thanks for giving me the time to share it with you today.
Great. Thanks so much, Christy. Really appreciate it. And again, as a reminder, we're going to have question and answer after all three of our presenters have a chance to talk. So next on the list, we would like to have Henry talk about his experience.
Hi. Great information. I'm really enjoying hearing from everyone. I was hired by the South Carolina Cancer Alliance about 3 years ago, and one of our new efforts is to diversify our funding and expand our work. We get funding just like many of you all from our state government as well as the CDC. But we acknowledge that the scope of our work would always be limited if we didn't diversify our revenue. So, and we are a private nonprofit. We are a 501c3, and I believe there are a couple others on this call. But the very first thing that we had to do is to get the buy-in and the commitment from our board. That was the very, very first thing that we had to do if we wanted to grow and expand the scope of this organization. And that took us about a year. Our first year, we raised around $12,000. And that was kind of, believe it or not, that was a huge accomplishment for our organization because it's not something that we've done before. And over the last 3 years, our current financial goal this year outside of our CDC and DHEC funds is over $150,000. And we did it in, I think, a very smart way. That first year, again, the commitment was with our board. We asked the board to donate money. And we hired a retired fundraiser to come in who's very, very well experienced in the fundraising world and especially in South Carolina. And we sat down and we said, how can we be very strategic when it comes to diversifying our revenue? So what we did is we actually said we're going to focus on three, it's actually 3 areas, but really 4. One is sponsorships. If you go to our website, sccancer.org, you're going to see on our homepage a list of events. And instead of charging a membership fee, we decided, you know what, we're going to go to pharmas, we're going to go to our ACOS partners, we're going to go to our corporations and our partners, and we're going to ask for sponsorships of these events. And it turned out it wasn't easy at the very beginning, but our fall annual meeting that's scheduled in October has paid for itself. So that freed up some funds where we can go back and hire more staff or use those limited funds on different initiatives. Some other things we did, we charged all of our task force with looking at grants. And we used some of the unrestricted funds in addition to hiring a fundraiser to hire, actually not even hiring a GA to work with our various work groups so they could identify grant opportunities. We had to change the mentality of our work groups. In the past, we just got our budget from the feds and the state and we divided up equally amongst our work groups. But what we really wanted to do, and it took us a couple of years, to change the mentality and said, you know what, HPV work group, here's an example. In the past, you got a $9,000 annual budget. Let's talk about getting outside funding. So we went to Merck, and Merck, we got $40,000 from them to kind of promote HPV vaccination in South Carolina. Same is true with our prostate cancer work group. We said, you know, if we limit our work to a $9,000 budget or we work really, really hard on in-kind, it's going to take us quite a while. So we went to Astellas and we requested $50,000, and we actually probably have about 6 different grants pending, ranging from pharmaceuticals to county-level healthcare organizations, all the way up to national nonprofits. And somebody mentioned this earlier. how do we decide on a goal? It's almost impossible to raise money if you don't have, lack of a better word, a sexy story to sell it. So last year we put together our budget, and it was our dream budget. There's no way that the CDC and the state government could afford this budget. So the financial difference in between our dream budget and the funds that we get from the federal and state government became our goal. And when we did that, we realized it helped us craft our ask. So when we go out to, I'm just going to use the Levine Foundation. So when we go to the Levine Foundation and request $40,000, our story's already there. What do we want the money for? Well, we want the money to go into the counties in South Carolina that have the highest death rates. How are we going to use the funds? Well, we're going to do policy systems and environmental changes, focusing on the faith-based system, the HUD homes, any other system that's unique to that county, and we're going to do it by implementing EBIs. And throughout our partnerships, the ask has become very, I use the word comfortable. I shouldn't say too comfortable, but when we first started, everybody cringed when they heard that we were going to go out and ask for money. But now, through a mentality shift, we realize that if we're going to have a great impact in South Carolina, we really need to quadruple our budget, because it's not going to happen if we sit back and just depend on state and federal government. Now, we're extremely thankful for their funding, but in my opinion, and the opinion of the board, it's everybody's responsibility in the state of South Carolina to fight cancer. So everybody has to foot the bill. And that's kind of the mentality that it's taken 3 years to get here, that we're kind of dealing with. We implement fundraising in every single aspect of what we do. It has just become part of our language. If you look at our website, if you look at our social media platform, we are constantly asking for money, because those funds, they go directly back into the cancer plan. When I took this job, when I heard that we had to prioritize our efforts, I kind of cringed, because I worked at the American Cancer Society and I worked at the National Kidney Foundation, and I get it. You have to prioritize. But if you have money, and I stress unrestricted money, everybody gets a fair shot. So with that, actually, I'd like to open up to any questions you guys may have.
Thank you so much, Henry. We appreciate your presentation. This is Leslie Given with Strategic Health Concepts, and I want to add my welcome to everybody. I want to actually move us to the next slide, and we'll go through just a few things. I want to give you some reminders about Q&A. So we have time now for all of the presenters around Q&A. We do have one question in our chat box, and I would just encourage everyone to put your question into the chat box. Remember to select everyone, and Margaret, I'll ask you in a minute if there are others that have come up in there. But right now, I want to encourage you to put your comments into the chat box. You can also raise your hand. Margaret, I think we'll be able to see folks who are raising their hands, and we might be able to unmute you if you have a telephone connection today. We should be able to unmute you. So I see that we do have one question, and actually I think this is really for you, Henry. This is around conflicts of interest. So the question from David is, for those in government positions or other 501c3 organizations, how have you avoided conflicts of interest around fundraising for an outside organization?
That's a great question. We had a situation. Everything we do as an alliance is we take the collaborative aspect behind it, and our number one partner is the state of South Carolina. So they are with us when we apply for grants. So I guess one thing I would recommend, if you're doing fundraising or going after grants, find the organization that can house the money for you. That is a nonprofit. So, and honestly, I've never, we're a nonprofit, so I haven't had experience with having conflict of interest. But that's
Thank you, Henry. Yeah, got it. And I want to ask you one question just to follow on that. So I understand you don't have conflicts of interest, but did you have any trouble in the beginning when you started fundraising just with perhaps organizations who are members of the Alliance feeling like you might be competing with one another? So, for example, American Cancer Society, other organizations that raise funds. How did you deal with that?
We addressed it head on. We have an ACS rep on our board, and the conversation is, honestly, it is what it is. We sat down, we had an honest conversation. I would say every single one of our board members, with the exception of State Health Department, they do have their own fundraising components. Now, we don't do events. And ACS, Relay for Life and Making Strides, that kind of is a large part of what they do. But honestly, you have to sit down and have an honest conversation. I don't think it's fair to smaller nonprofits to be expected to sit back while some of the others get the money. It is what it is. If we want to impact cancer in South Carolina, we have to raise the funds. And I haven't had any pushback from our members, and our active members are ACS, Komen, you name it. And they're part of the solution. They work with us.
Great. Thank you so much, Henry. I appreciate that. We have another question from Caleb, and it's for South Carolina and Colorado. Have you noticed a shift in priorities, fundraising versus cancer control? And have you turned partners away because you fundraise? So let me go to Christy, to you in Colorado. Have you noticed any change in the way partners engage because of the fundraising?
So I'll answer the second part first.
Okay.
I don't think that it has, I don't think it's turned partners away. When we did the membership model, instead of a fiscal sponsor model, we did turn people away, but our current fiscal sponsor model has been working for us. In terms of a shift in priorities, I haven't really seen that either, because the people that are still involved now were involved when we wrote the priorities. I think maybe when we rewrite the cancer plan for the 2021 to 2025, maybe we'll see that. But so far, it's been the same people at the table. So we haven't really seen a difference, or people being annoyed that we asked for fundraising. I would say, to kind of follow up on what Henry said, we just keep asking. We'll occasionally hear we can't ask for money for you because we asked for money for our own organization. And we just wait a few months, and then we bring it up again, and we talk about how important collaboration is. And then eventually everyone comes around.
Okay, great. Thank you. And I don't think, Henry, from what you said before, that partners are turned away because you do fundraising. So that's good news.
Yeah, and we haven't seen that, but I want to stress, when we all develop our cancer plans, we put in their objectives and strategies that are data-driven. That's what we're asking funding for these specific projects that are funding projects in the counties with the highest mortality rate. So when you go to a funder, you have something tangible that's data-driven. We have not seen any kind of pushback or negative reaction because our ask is so solid.
Got it. Thank you. And Margaret, I want to ask you, have any other, I see one more question that was posted here for everyone, but I want to ask you, any questions coming to you directly, or do you see anyone who wants to come off mute?
No, I don't see any questions, but please feel free to send me a note if you'd like to come off mute and join the conversation at this time.
All right, so we have another question from Sarah to everyone. Sarah asks, can one or more speakers talk about how members of the coalition have brought resources to the table? What does that look like? What type of activities are supported, and how you coordinate it? I think that's a really great question, especially if we're thinking in kind. So I think I'm going to throw this question to Hope and to Julie. How do you coordinate the in-kind resources that are brought to the table?
This is Julie, and I can talk about it in relationship with some of the things we do with Midwest Cancer Alliance, but also with some other activities in our partnership. With the Midwest Cancer Alliance, when we started out with the relationship with the shared position, I think I mentioned initially we had weekly phone calls, and now it's turned into monthly. But a lot of what we do during those calls is talk about here's what each of the entities has going on, and that gives us an opportunity to share. Hope will talk about what she's going on and putting resources in, and we talk about what we can use. And, sometimes there's an ask from one agency to the other, but more often people are just volunteering things as they see in areas where it makes sense. Another project where we had a lot of success with partners bringing resources to the table was our health systems initiative, and it really, being involved in the State Cancer Partnership kind of opened the door to the whole thing, because we sent a team to the colorectal cancer 80% by 18 workshop, and after that workshop, the partners who were there met. And just each one of them, we all sat around the table and said, here's what I can bring. So the State Health Department contributed resources from the State BSEP program and the Comp Cancer program. And American Cancer Society has contributed a lot of staff time put into coordinating and developing partnerships and organizing. The State Primary Care Association had received a new grant where they have resources to help FQHCs and other clinics in the safety net to better use their medical record systems. Who am I reading now? Oh, the Kansas Healthcare Collaborative is part of the Patient Transformation Network, which has quality improvement advisors, a network of them around the state, and they are in place and trained to provide technical assistance to clinics who are wanting to better use their medical record systems, and that's all part of a larger initiative out of CMS for new payment models, that sort of thing.
Thank you, Julie.
Okay.
And thank you, Julie. I appreciate that. I think it sounds to me like to help coordinate everything, it's just to get all the partners around the table. So I want to end this today. I want to thank all the presenters for coming on and sharing. We've got a couple questions here in chat. Feel free to answer them. Did the webinar enhance your understanding? Do you intend to use the 9 habits? So I see a couple people have said yes, and they're already using it. So thank you for entering your information there. And I actually want to end saying, we have 9 habits. We focused on 3 different habits in this series, but there are 9 habits, and we are working on updating the 9 habits guide that I'm sure many of you have seen So if you have a success story to share about any of the 9 habits, multiple ones or any others that we haven't talked about, please get in touch with Karen and myself, and we would love to work your success story into the update of the 9 habits. So you can see our email addresses here, Leslie at shconcepts or Karen at shconcepts.com. And I want to just say thank you to all the national partners and for all of the comprehensive cancer control and immunization coalitions, if any join, for joining us today. We appreciate you coming on. And please visit us at the National Partners website, and you'll find an archive there of this webinar today and the others as well in the series. Thank you so much, everybody. Have a great day.